I'm Steve Shortell, and I'm currently the Blue Cross of California Professor of Health Policy and Management at UC Berkeley. I'm also Dean of our School of Public Health at Berkeley. I also hold an appointment in the Haas School of Business there. I got started in my academic career at the University of Chicago, where I did my doctoral work and taught there for a couple of years, and that's where I first met Bill Richardson. Bill was several years ahead of me in the doctoral program there, and when I completed my studies, I stayed on for a couple of years and served as acting director of their program for a couple of years, and then was eventually recruited here to Seattle in 1974. Those were exciting times for the school, and for those of us that joined the school at that period of time. It was a little bit after the school had its beginnings, but it was beginning to grow and achieve very quickly national recognition for the quality of the faculty, quality of our students, and the research monies that we were beginning to gather. And I was very proud to be a part of that. I felt as a young assistant professor at that time that I was sort of in at the beginning of something that was important and with some very good people. I remember that what I taught at that time was two courses. One was a course in sociology of health and illness, and I also taught a course in program evaluation with a professor from the School of Public Affairs by the name of Walt Williams. I remember Walt well. And then a special opportunity was to teach the introductory public health course. It was special because I had a chance to do that with Betty Gilson. And I'll remember that occasion because this was always a very difficult course to teach, as it probably still is today, because you had such a heterogeneity of students, large number of students in that course. It had to cover a variety of material and how to pitch it. And I remember this well because after getting the evaluations, I think on a 5-point scale, my evaluation was 3.8. And I was just totally distraught. These were the lowest course evaluations I had ever received. We all pride ourselves on being excellent teachers, but I had always done very well. And I remember going into Bill Richardson's office shortly thereafter to get some kind of feedback, and I was prepared for absolutely the worst, that he was going to tell me this course had not gone well and I really needed to do a lot different, only to learn from Bill that the 3.8, at least at that time, that Dr. Gilson and I had achieved was the highest evaluation the course had achieved up to that point in time. So that made me feel a little better, at least. One of the things that was very much a positive for me here in Seattle was the multidisciplinary research projects we had an opportunity to address. Health services research, which is my background, inherently is multidisciplinary, and you have to look at the problems from multiple viewpoints. And we had the people here that enabled us to do that. I remember forming a strong partnership with Jim LaJerfa, who is still here, and several others, Marilyn Bergner, of course Bill, and some of the economists in the school as well. And I worked for a while on the Model Cities project, which Bill Richardson brought out from University of Chicago days. It was actually his dissertation earlier on, and we completed some of that work here in Seattle. And then we launched a major project with funding from the Robert Wood Johnson Foundation that I and Bill Dowling and Steve Williams, who was here at the time, had a chance to play a leadership role on, along with many others. And this was the national evaluation of 53 hospital-sponsored primary care group practices. At that time, it was the largest evaluation that RWJ had funded, several $1 million over, I think it was 4 or 5 years. We had a great time with that, numerous articles, a book that came from that as well, but also a lot of wonderful experiences. And one that I remember very well, that Bill Dowling and Steve Williams and I remember very well, occurred Salt Lake City, Utah. One of our sites was the Intermountain Health System there. And we would go out and do these 2-3 day interviews. And on this particular site visit, we were scheduled to meet with the CEO of the hospital, I believe it was. And just before we got ready to go in, as I recall, the interview was canceled because somebody else had gotten in there and to talk with the CEO, and apparently it was something urgent. So we completed our visit that day and got on a plane to go from there actually to, I think it was Princeton, New Jersey, to the RWJ headquarters in Princeton. And on the way there, Steve Williams and Bill Dowling and I were sitting in the plane. We were all across in a single row. We were kind of reminiscing on the day. And Steve Williams in particular was just complaining a lot about how we thought we had a good day but missed a lot because we hadn't seen the CEO, and how disrespectful it was of our time and for whomever it was that got in to steal this guy's time before us, so forth and so on. And as Steve was talking, Bill Dowling and I noticed the fellow in front of us kept cocking his ear back sort of and occasionally swiveling his head looking back at us. And we weren't exactly sure why. The plane finally landed in Newark, I think it was, and we're getting up to get our luggage off the rack. And he turns to us and says, you know that canceled interview you had today with the CEO? I'm the one that was in with him. And what I had was more important what you guys were doing. I think Steve Williams turned 4 shades of purple, and Dowling and I ran for the exit because this guy wasn't too pleased about what we had been saying, ripping him impersonally, of course, pretty much up one side and down the other about what a yo-yo it must have been that got him to see the CEO before we did. But we had many interesting experiences doing that study, and that is one that I do recall offhand. The other thing that occurred when I was here in Seattle that we were all very proud of, and I was pleased to play a small role in it, was we were one of the first and the only new Center for Health Services Research. In 1976, I believe it was, the National Center for Health Services Research, as it was then called, it's now the ARC, Academy for Health Research and Quality, did a competitive grant proposal to become a center, 5 years of programmatic funding. There had always been centers at Johns Hopkins University, at University of Pennsylvania, University of Michigan, University of North Carolina. They had always done a fair amount of health services and health policy research. We were the new entrant, along with many others around the country, and we were awarded one of the 5 awards, and along with the other 4 that I just mentioned. And Bill and Bob Day, who was then dean of the school, asked me to head up that center, which I was more than pleased to do, although I was a fairly young faculty member at the time. And we recruited some marvelous people. Ira Moscovice, who's now at University of Minnesota, Andrew Dolan, who I think has gone into health law practice here in Seattle, many of the faculty here at the University of Washington already within the school. And pretty much year in and year out with the evaluations received, we received pretty much the highest evaluations of any of the other centers in terms of what the visionaries of these centers wanted these centers to do. We not only did some of the fundamental health services research, but we also paid a lot of attention to getting that out to change public policy in healthcare, and linking that up with the users of research as well. And one of the things we did with those resources is hired a full-time librarian, a health services librarian, for the Department of Health Services. And to my knowledge, that position still exists today and performs a service, I think, not just for the department, but for the entire school, and to some extent, perhaps the Health Science Center here as well. The first occupant, I believe, was Laura Larson. I don't know if she's still here, but I do remember Laura in the early days, and she was marvelous. And so that was certainly a very meaningful experience for me during the time I was here. I also was involved to some extent as I rose through the ranks here and became a full professor. And in 1980, I was selected to chair the Department of Health Services here, which I was very pleased to do and thought I'd be doing for some time before I was actually recruited back to Northwestern University. But during the time, we were able to recruit some wonderful faculty, both before I was chair, clearly, but also during that time. Some of the people I remember that Bill Dowling, Bill Richardson were very influential in recruiting. Cindy Watts, Carolyn Watts, who is here now, Doug Conrad, who followed Bill and I in getting his PhD from the University of Chicago. It's kind of a Chicago-Washington linkage. Bob Day did his medical work, his medical degree at University of Chicago, before he came out here. But we recruited Doug here. initially between the dental school and public health, and now Doug is full-time in the Department of Health Services. Another person we got interested was Tom Wickheiser. And Tom was one of the first people I hired on our Robert Wood Johnson Foundation study I mentioned earlier. I think he had a degree here in social welfare. He worked on our project. We got him interested in doing doctoral work, and he eventually went back to the University of Michigan for his PhD, and then was recruited back here to Seattle, where he has been in the last several years. So Tom was recruited during that period of time also. And so I remember very fondly some of the people that we were able to attract that helped to build this school so quickly. I would say that I've been very pleased over the years to maintain a relationship with some of the faculty here through some of my own research, which has been looking primarily at the organizational and financial determinants of quality and outcomes of care. We've done a lot of work on integrated health systems in this country, a lot of work on quality and outcomes of care, and I've been able to do some of that with Doug Conrad, who's been here, and Doug and I have been involved over the years in the Center for Health Management Research, which was a product really of a center that I founded at Northwestern University when I went to the Kellogg School. We merged it with a center that Howard Zuckerman had founded, and Howard was a faculty member here for a number of years. We put this center jointly together. Along with ourselves, I had gone to Berkeley then, and then in recent years that center has been co-chaired by Doug and by Tom Rendall at UC Berkeley. It's been a very good success, had a lot of impact, particularly in bridging academia and healthcare provider communities. So much so, it has now become an important entity of the Health Research and Educational Trust for the American Hospital Association. And we were able to kind of broker that arrangement over the last couple of years. The basic idea there is where health systems, leading health systems across the United States define the problem and then send out RFPs to about 16 universities of researchers who can then submit proposals. But the proposals are actually reviewed by those who are going to be the users of the research with some input from academics, and they select the proposals that they want to have studied on the topics they want to have studied. And this has worked very well, and I was very pleased to be a part of that. So that's been ongoing contact with Doug Conrad. I've also had ongoing contact with Bill Dowling over the years, different forums. Probably one of the most continuous has been that Bill and I have been members of a group called the Health Policy Issues Group, or HPIG for short, HPIG, Health Policy Issues Group, which would meet every summer, usually in a fairly nice place, and we debate the world's problems, at least in terms of health policy, for a couple of days and also have some good times. And until that began to conflict with other schedules I had, I was a member of Bill, may still be, but it was great because that would give us a chance to catch up at least once a year. One of the things I remember when I first came here from Chicago and got to know some of the other junior faculty is I was parked in the S1 parking lot. I lived about 15 minutes from campus, and as often as not I would walk in early in the morning with two young members of our biostatistics department then, Polly Feigl and Pat Wall. And I remember we would go in the elevator on the floor down here that was -1. And after a week or so of this, I noticed that there was no zero floor or main floor. I went from -1 to 1. I thought that was a little bizarre. And I remember turning to Polly and Pat one day and just telling them offhand, gee, this building must have been designed by a deranged biostatistician. There's no real zero floor or main floor. It goes from -1 to 1. And, I think Pat smiled weakly. She saw a little bit of the humor, but I think she thought I was somehow criticizing her discipline. I don't remember Polly's reaction at all. But I do remember that's how I first got to know Pat Wall, and Polly Feigl also. And had a lot of respect for them, and we were, Polly may have been an associate professor then, I'm not sure, but Pat and I were young assistant professors. Another story that I remember fondly involves Bob Day. And I must say that I think Bob, during the time I was here as a faculty member and really rose through the ranks, in my view, was an outstanding dean. He was largely responsible for encouraging us to apply for the Center for Health Services Research Award, and he was out in front on a lot of issues. And I do remember one day he and I went out, and I forget the occasion, it was an off-campus meeting, and it was about 2, 3 o'clock in the afternoon, and he turned to me on the way back to campus. He said, "Steve, you want to go get a drink?" And I thought, well, what do you mean, go get a drink? And I said, well, okay. And my experience with Bob at parties and that is he enjoyed wine and so forth. And so I thought, the way he said this, I thought it was a bit bizarre, a little bit early to get a drink. But, off we went. Well, as it turned out, we went into a local shopping center, and I think we got root beer floats. That was his idea of a drink, but I also think he was pulling my leg that day, and just for fun. But we took a half hour and had a root beer float or whatever it was before returning to campus. I think that's the softest drink I ever saw Bob Day take. But he was great, and I remember about 3 or 4 years after I was here, and I became the department chair. I think it was the first time he began to have regular meetings of the department chairs. It didn't start out that way, at least not to my knowledge. And those were quite interesting because I learned a lot from watching Bob on how to orchestrate those meetings, what to talk about in the meeting itself, and what was best handled offline, as we say. And so I was maybe prepping for when I would take on more administrative duties later on in my own career. But an awful lot of respect for Bob Day and all that he did for the school and really grew it in those early years. I also enjoyed greatly the interaction I had with the Department of Family Medicine, with Roger Rosenblatt. And Roger and I collaborated on some work, and he was an important member of our Center for Health Services Research. The center, although based in the department and in the school, reached out across the campus. And we had good relationships with a lot of folks on campus. And I think the university enjoyed some very effective leadership during that period of time from President Hogness, who was the founding president of the Institute of Medicine, was also president here. And I remember Roger Bolger, who went on to be at University of Texas and other places as well. And being in meetings with Bob Day with some of the leaders of the Health Sciences Center throughout the campus here, and was very impressed with what they were doing and the role of the school in some of the health science-wide activities. And I give Bob Day a lot of credit for that as well. A couple other stories I recall of some of our faculty. One of the people that worked with us on the Johnson study of primary care practices was John Guyman. Dr. Guyman was chair of family medicine here at the University of Washington for a number of years. And one of the sites that John and I visited was Sioux City, Iowa. And we would always go there in January, cold, 20 below 1 year, etc. And what I remember about John, and he just drove me crazy, is he was somebody whose idea of making an airplane flight was to arrive on time just as they were flashing, all boarding, and race on just before they closed the door. I'm just the opposite. I don't want to take a chance. I'll get there an hour early, sit there, do work or read. But that wasn't John. And he did make all the site visits, but just barely. He also revealed to me that at one very big meeting, I think it was in Philadelphia, he was the keynote speaker. It may have been the American Academy of Family Medicine. And he slept through his keynote address. They had to call him at the hotel. They couldn't rouse him. They finally got him up, and they said, "Dr. Guyman, where have you been?" And he missed the keynote address. He'd gotten in late. I guess didn't set his alarm clock. So that's a John Guyman story that I remember. But John was wonderful, a real leader in family medicine. Another story I do remember involving Bill Dowling on one of our other trips. And this was an independent trip to the foundation in Princeton, where we ran into some real problems. I think it was in Denver at the time with a snowstorm in which the flight began to descend and you almost feel it touching the ground, but at the last minute went into the air, and to the left we could see the air tower controllers practically waving to us. The pilot comes on and says, "We're really sorry. A blizzard here in Denver." This was the old Stapleton Airport, and the people in the control tower said at the last minute a piece of snowplow equipment had come on the runway just where we were about to land. We're just going to go around and we'll try it again. So it takes 10 or 15 minutes. We go around. We can see the snow coming down. We again begin to descend. And this time we don't get down quite as far. Gives it the gun again. And he comes on and he says, "Well, I'm really sorry, but this time we were called off because they closed that runway. There's one runway left. We're going to go for it tonight. We want to get you in here. So we're going to try for it once more." And I looked over at Dowling, who's usually a pretty calm, controlled guy, and Bill was white-knuckled. His knuckles were white, and mine were at least that as well. And to make a long story short, third time we did get down, but as we touched the runway, we slid. We veered like this, swerved, and finally came to a halt. And so I do remember that experience as well. And fortunately, we're here to remember it. One of the things about the University of Washington when I came here that I really appreciated was how easy it was to work with others, both within the school, across the various divisions, but also with the medical school here and colleagues, as I mentioned, in internal medicine, family medicine, and some of the other units as well. And this made it much easier for me as a junior faculty member to get my research program started and to work with colleagues whose skills and insights I needed that I didn't have. And I know in some other schools of public health across the country, it's a bit more of a challenge when you're on a health science campus of necessarily making those bridges and initiating those ties to other units within the medical school, where sometimes there's been barriers to being able to do that. And that did not exist here at the University of Washington. So this, I think, was one of the differences, and I think that has been maintained over time. The other thing that struck me when I came here was how well tied the school was, maybe being a relatively new school in a public university, to the Seattle community, and furthermore, beyond that, to WWAMI, Washington, Alaska, Montana, and Idaho, the training ground in medicine and all the health science professional schools for the region. And I remember when we got the award for the Center for Health Services Research, one of our contracts actually was up in Alaska on a program evaluation project. And I remember that at the time, in terms of the academic cycle, we suggested to our colleagues in Alaska, we were working with the Indian tribes there, that it would be best to make the visits and have the big meetings in June or July after graduation when we had more time. And I remember them shaking their head and saying no. We weren't to be trusted. We lacked credibility if we came in the summer months. But a better time for them was January. So I remember trekking up to Alaska, to Anchorage, at least 3 times, 3 years in a row in mid-January to conduct these evaluations that we were a part of. But that was pretty much typical of the university and the school, that it existed to meet the needs of the communities here in the Northwest, and of course in the state of Washington in particular, and Seattle within that. I think emblematic of that is what Pat Wall did when she became dean. Soon after she became dean here in Seattle, one of the first things she did was to make a visit to all the health departments throughout the state to get to know them, what their problems were, and how the school might be able to contribute to that. I think that was a wonderful thing for her to do, but it's very, I think, typical of the relationship the school has had with the state, and in particular in Seattle and King County. When we were awarded the Center for Health Research, that was a great boon for the Department of Health Services and the school at large. And some of the research we conducted with that award and the resources that gave us, I've already talked a bit about the primary care study. And in many respects, those were some of the initial hospital-physician joint ventures. And we were able to lay the groundwork for some of the subsequent work on integrated health systems. And in particular, when the Clinton proposal came along in 1994, some of the research that they drew on was research we had done here in Seattle and other places around integrated health systems and what kinds of incentives would be needed to get physicians and hospitals to work together and create more of a continuum of care, particularly for people with chronic illness. And so some of that work began here, and also going back to the model cities work as well in terms of improving the community's access to care. So these were some of the later on policy developments in this country that can trace some of their origin back to some of the research we did here in Seattle, as well as, of course, many other places around the country. Also, it was when I was in Seattle and then subsequently went to the Kellogg School at Northwestern, but the seeds were planted here in Seattle for starting a new association for this growing field of health services research. And I, along with Stuart Altman at Brandeis and Cliff Gauss, who was then the administrator of HCFA, the Healthcare Financing Administration, and a few others were the founders of what was then the Association for Health Services Research. And I can remember we met literally in a basement room of a hotel in Washington, D.C. to have the key meeting. And how would we form this association, and how would we get funding for it, and how would we influence the national agenda? And that started during, I believe, the last year or so I was here in Seattle. And that is growing today to be the premier health services and health policy organization in the country, now called Academy Health, with 4,000 members. And I remember fondly that the first meeting we had was in Chicago. I was then in Chicago, and we had about 350, 400 people, and I chaired the program committee for the very first meeting of the then Association for Health Services Research, was subsequently elected president of that organization, and a number of University of Washington faculty have been leaders in that organization ever since, Doug Conrad among others. And so we're very proud of having a role in that, and some of the seeds of that idea began here in Seattle and at the university. Another program that I remember fondly when I came here was the Medics program, started by Richard Smith, and it was one of the first, if not the first, physician assistant training program in the country. Remember, this was the 70s, and we were thinking we were in a physician shortage. We needed to train people differently, and so the physician assistance program was born here. And when I was here, the director of that program was David Lawrence. And I remember David fondly. He and I became friends here and colleagues. He subsequently went on to head up the health department in Multnomah County, left that to join Kaiser Permanente in Denver, rose through the Kaiser ranks to become the president and CEO of Kaiser Foundation Hospitals and Health Plans, which he provided superb leadership for many years before retiring about 3 or 4 years ago. And when I was chairman of the department here, I remember Dave fondly, and I remember previous department chairs, including Bill Richardson, saying what a thorn in the side Dave could be at times, as much as we liked and admired him, because he was always pressing. And the Medics program was always a bit of an anomaly, because it was the only direct caregiving program training clinicians in the department, and for that matter, in the school. So it kind of stuck out like a sore thumb. They didn't know where else to put it within the university, perhaps. A lot of us felt it should be in family medicine, but they put it in School of Public Health and Community Medicine. So Dave would constantly be arguing for this, that, and the other thing. And when I became department chair, we went to lunch, and I said, Dave, we need to work out an agreement here, that in public meetings, when we're there around the table, and you're head of the Medics program with the other chairs, at least pretend to play along with things and be a good participant. And then offline, in private, one-on-one, you and I can strike deals that get you what you want and still move us forward as a department. And he says, Steve, okay, we'll do that. And that's the way we operated, I think, fairly effectively for a couple of years, is Dave would behave himself in these public meetings, and then privately he'd rat on my ear about this, that, and the other thing. And usually, as I recall, he would get his way, but without necessarily compromising in front of the others what we needed to do to move the entire department and school forward. Dave and I subsequently, I've had a chance to become friends in a lot of other venues, particularly when I came back to California and he was president CEO of Kaiser. One of the things that any faculty member is able to talk about fondly are the students that he or she has had. And I've always said to others that you kind of wait until your students make their mark in life before you claim them as your own. And I've had occasion to claim several students here at the University of Washington as my own. I, of course, was privileged to teach many students during my 8 years here, but there are 2 or 3 in particular that stand out. And I'm sure I'm doing a disservice to many, many others. But one is Cheryl Scott. Cheryl is now Chief Operating Officer at the Gates Foundation, but perhaps is best known here in the Seattle area as being President and CEO of Group Health Cooperative of Puget Sound. And when I first came here, Cheryl, I think, was in her first or second year in the master's program. I met her informally in the hallway or at a meeting. She struck me as very high energy, very bright. I had her in class. It was my class in Sociology of Health and Illness. At the time, I also had the clinical scholars in the class. The UW was one of the 6 clinical scholars program in the country, along with UCLA and Penn and a number of others. I think Stanford, UCSF had a combined program. And these were wonderfully bright clinicians, physicians who were getting a master's degree in public health, learning about health services research and health policy. And so they would take my class in Sociology of Health and Illness along with many of the MPH students. And I remember that with their clinical background and their clinical experience, sometimes they would tend to dominate the class a bit. But Cheryl, and I would try to encourage the other students to speak up, Cheryl was not shy. And in particular, I remember one class session in which Eric Larson, now was a clinical scholar at the time, made some comment, I forget what it was in class, with a great degree of confidence that he was absolutely right. And Cheryl immediately challenged him and pointed out some data that he wasn't right at all. It was kind of foolish what he had said. And I remember after that class, and some of the students in the class kind of gasped, that Cheryl Scott should be challenging Dr. Eric Larson. In class afterwards, Eric comes up to me and says, "Who is that person?" And I said, "Well, that's Cheryl Scott, and what you said, was right." He said, "I know she's right. I know she's right. Damn it, I know she's right." But that was Cheryl. Cheryl was more often than not right, and she kind of told you so in a nice way. But she was just wonderful. You knew she was a leader from the first time you met her, and did marvelously well with her career here in Seattle. And Cheryl and I have, from time to time, been able to renew our friendship. Most recently, a year or so ago, with the Institute of Medicine Committee that we are on to improve our nation's healthcare system, particularly around performance incentives. And we stay in touch with Cheryl now in her position at the Gates Foundation. Another person I remember from the early days here in Seattle is Mike Rona. And Mike also, you knew, was going to be a leader and affect some very meaningful change, which he did numerous years at Virginia Mason Medical Center here in Seattle. And again, I had opportunity to reacquaint myself with Mike by a study we did in which Virginia Mason was one of the participants. And Mike was one of the people we interviewed during that time, and I thoroughly enjoyed that because it gave me a chance to catch up with Mike's career, and he did terrific. And a third person I remember, and I'm not exactly sure what he's doing now, he went into consulting for a while in the IT space, was Greg Bennett. And Greg actually worked with me on our RWDA project, as I recall. He was one of those master's students that was unusual in that he seemed to be more interested in research, even though I don't believe he pursued an academic career. And Greg was just very energetic, very bright. And I do remember Greg, and we stayed in touch for a while. I've kind of lost touch with Greg I believe he may still be in consulting somewhere in the Northwest. There are many other wonderful students here in Seattle, but those are three that I clearly remember. And I also know that it was a real challenge, even at that time, the 8 years I was here, of all these bright people in our program, encouraging them to take the best opportunity they had and to learn and to take positions across the country or wherever it may lead them, because they were all in love with the Northwest. They all wanted to settle here. And some of them, I remember, took positions outside of healthcare. They opened art galleries and so forth because they wanted to stay in the area. And no one should criticize them for that. Everybody has their priorities, and that's great. But for some of us as faculty who wanted to spread the wealth around the country of all these wonderful students and graduates we had in Seattle, we probably weren't able to do that as much as we would have liked. Two other people that I remember fondly during the 8 years I was here at the University of Washington, one was Ed Perrin. Ed was a very distinguished biostatistician, in fact headed up the National Center for Health Statistics for a number of years and returned to the area. I remember Ed spent a fair amount of time at Battelle, and this was another relationship very important to the department and the school. We put in a lot of joint proposals. In fact, one I remember that Ed probably remembers all too well is a joint proposal we were working on at the last minute. Mostly it involved Ed and his Battelle colleagues, in which we were going to fly the proposal back to Washington, D.C. to meet their deadline, because we needed to work on it up to that point in time. And as luck would have it, the airport, SeaTac, was socked in. And so then we tried to go through San Francisco, as we recall, or Portland, and it was socked in. And as I remember the story, it didn't make it, and they did not accept it because of they wouldn't accept our excuse. They said you should have planned for it. I don't know how it eventually turned out, whether we had a chance to do it on another cycle or not. But Ed increasingly spent more time with us here in the department and chaired the Department of Health Services. In fact, I think he may have been my immediate successor after I left to go to the Kellogg School at Northwestern. But very fond memories of Ed. He was a good friend. And another person in my early days was Ken McCaffrey. Ken was a health economist. In fact, may have been the school's first health economist. I'm not sure. It was near the end of his career when I came. But he befriended me that first year or so, kind of showed me the ropes. And I think he was also involved over at Battelle, perhaps. But in any event, I do remember Ken. And I was remembering some of our students. One of our doctoral students I remember very, very fondly, and we remain friends and colleagues to this day, is Mike Morrison. And in the days I was here, we didn't have a PhD program of our own, but we started a doctoral opportunities program, which I directed. And basically, this was where people could get a degree in economics or in the business school or in sociology, concentrate in health services research, and by taking certain courses and doing their dissertation in the area. And I chaired, or I don't know if I chaired Mike's committee, but was on his thesis committee. And he's had a very distinguished career in health economics. He's now at the University of Alabama School of Public Health. And his wife, Elaine, was the first person I hired to help us out with our new Center for Health Research. She was my administrative assistant and set the bar for others that followed her. So these are very important relationships in the early days. I would say that my years here in Seattle at the University of Washington was an imprinting period for me. Although I started my academic career at the University of Chicago and taught there for 2 years and started my research programs there and teaching, you really have to get away from where you got your PhD. And for me, that was here in Seattle. I could not have selected a better place. And although I went on to Northwestern and now at Berkeley, the University of Washington was a very positive imprinting period for me. And I feel really fortunate I've been able to maintain ties to the school and my colleagues here ever since.